Hello. This week I'm going to talk about something that every breastfeeding and pumping mom dreads, and that is a clogged duct. They are painful, can affect your supply, and can be difficult to resolve. So we're going to talk about all of that today. If this is your first time to our channel, I'm Sarah. I am a board-certified OBGYN, a fertility specialist, and currently breastfeeding my second baby. I share this channel with my husband, who is a pediatrician, and we share medical educational content on pregnancy and parenting, as well as our in real life experiences as we are living it. Welcome back. As I mentioned, this week we are going to talk about clogged ducts when breastfeeding or pumping. What are they, why they happen, and what science has shown is the best way to resolve them. So I remember I was about a week or two postpartum with my first baby, and shortly after my milk came in, I got a clogged duct. I started noticing this firm spot on the upper left side, and it started hurting in the morning, and then kind of like by that evening, I could hardly even lift my arm above my head. So I did some Googling, texted some of my mom friends because I really had no idea what I should do. And the advice I got at the time was to take a hot shower, massage it aggressively, like while I was in the shower, and try to express milk. And I will never forget this quote, get it mammogram flat. So really working to squeeze this clog out. So I did get some other tips, including trying dangle feeding, the haka with some Epsom salt, massage while pumping with the pump on maximum suction, getting a needle to unroof a bleb, and worst case scenario, have your partner suck it out, which my husband was horrified by this idea. So I think pretty sure what got that first clog out was I did take a hot shower, did some massage while I was pumping on max suction, and that did eventually get it out. I then started on sunflower lecithin, which we'll talk about in a little bit. But I knew I didn't want to do that again because it was super, super painful and uncomfortable. And it also kind of felt like it affected my supply for the next week or so. But since that first clog and that first pregnancy breastfeeding journey happened, there have been some new recommendations from the Academy of Breastfeeding Medicine. As it turns out, aggressively massaging your boobs and heat are not the answers, kind of the opposite of what you want to do, and those things can make everything worse. So let's first start by talking about what exactly is a clog. And a great place to start with that is to think about breast anatomy and what's going on. So in the breast are the alveoli. Those are the milk-making cells. They are connected to ducts that carry the milk out to the nipple to feed babe. So when most people think of a clog, or you hear the word clog, you think there is a discrete blockage in that pathway, in the duct, so the milk can't escape, kind of like a cork in a bottle. But that's actually not what the science has showed us is going on here. What is happening with a clogged duct is as those alveoli are making the milk for whatever reason, whether it's, you go longer without feeding or you don't completely empty, you get a swelling of lymphatic fluid in the breast, in this focal area, and it compresses those ducts. It squeezes those ducts, and so the milk can't get out of that area of the breast. And that can be very painful and can cause a decrease in supply. And if it doesn't get resolved, it can actually make mom really, really sick if you get mastitis. So what are some risk factors for clogs? One big risk factor is hyperlactation or an oversupply. This puts you at an increased risk for clogs because often you are not completely emptying the breast, or baby isn't completely emptying the breast. Other risk factors for clogging include pump usage. Again, that's because pumps don't remove the milk as well or as physiologically as an infant does. Babies really are the best pumps. And kind of same thing with a nipple shield. They prevent that physiologic feeding and can cause milk not to be completely removed. So there actually is some new recommendations on how you should treat a clogged duct in your breast. And this is based on this new information of what a clog really is. That is really swelling in the breast tissue that is compressing those ducts. And so all of this advice is kind of centered around how do you reduce swelling so that the breast anatomy and machinery can function the way it's supposed to. So one of the most important things to remember if you get a clogged duct is actually do not massage it, especially not aggressively. So the ducts are microscopic and they're within this tough, dense breast tissue, and massaging this gland just makes the swelling worse and can cause tissue damage. Deep massage causes increased inflammation and more tissue edema and microvascular injury. You also, want to avoid electric toothbrushes or other commercial vibrating or massaging devices. Advice I was given, tips to try to get it out, actually not the best. In fact, a systematic review was done and it concluded that although breast massage may reduce pain, it should not be recommended as a standard of care because it requires extensive training to master an atraumatic approach. The most successful techniques for doing, massage and lymphatic drainage is kind of a light sweeping of the skin, not deep tissue massage. And again, professionals do this best. So that's why we don't recommend it for me and you mashing on our boobs trying to get this clog out. So what are the Academy of Breastfeeding Medicine's recommendations? Essentially, they revised their whole protocol in 2022. It is the ABM protocol number 36, the mastitis spectrum. I can link that below so you can check it out if you want to read the whole thing. But basically they had 6 big recommendations. The first was to decrease inflammation and pain. The next one was to treat associated nipple blebs but avoid unroofing. Treat an oversupply was the third one. The fourth is to use therapeutic ultrasound if you have access to that. The fifth thing is to only use antibiotics if it is bacterial mastitis. So that's something to see your doctor for. And the final 6th thing they recommended was to consider probiotics. The systematic reviews are mixed on that, but if utilized, the probiotics should contain, I will put these on the screen, Lactobacillus fermentum or salivarius, Lactobacillus salivarius. So those were the 2 probiotics to consider. So the creative way to kind of summarize and remember those ABM recommendations is the mnemonic B.A.I.T, B-A-I-T. So the B stands for breast rest. This means we're trying to give the breast a break, just like you would a swollen ankle. You do not want to over pump on that breast, trying to get it to empty. You don't want to overfeed and keep putting the baby on that breast. You can put the baby there as you normally would, but for the most part, you are trying to give your breast a break. The A stands for anti-inflammatory medication like Advil, Motrin, ibuprofen, all the same thing. The recommendation for dosing in the protocol is 800 milligrams every 8 hours. Again, that is helping reduce inflammation. The I in B.A.I.T stands for ice. This is for symptomatic relief. It feels good, and ice also helps decrease inflammation and swelling. That is something that you can apply every hour, just kind of ice pack to the breast. The T in B.A.I.T stands for Tylenol or therapeutic and therapeutic ultrasound. So for Tylenol, this really helps with pain a little bit. The recommended dose in the protocol is 1,000 milligrams every 8 hours. You can take this with your Advil or ibuprofen every 8 hours to help with pain and reducing inflammation. If you have therapeutic ultrasound access, someone in your community does that. Studies have shown that it can help with a clog. So go for that if that is something that you have access to. It's important to know that when using B.A.I.T to resolve a clog, symptoms usually resolve within 24 hours. It is really, really important to remember that if any plug or mass in the breast isn't resolving after several days, it is really important to go see your provider, especially if you develop a fever. Call your doctor right away. If that plug isn't resolving with these conservative measures with B.A.I.T, go see your OBGYN or doc, as they may want to do some imaging and other things. Other tips, you can consider, if you note that you're experiencing blebs. I know you may want to get a pin to get rid of them. That's shown it can make it worse. You can use 5 to 10 grams daily of sunflower lecithin to help with inflammation and to kind of thin out the breast milk. Their poke root is another herb that you can consider. The mechanism of action of these, both sunflower lecithin and the poke root, is unknown, but again, they think it kind of helps to emulsify or thin out the breast milk and help with inflammation. So what has been my experience with B.A.I.T? Because as I talked about earlier, with the first breastfeeding journey, I was definitely a aggressive massage, hot shower, doing all the things you're not supposed to. And I have actually found that this B.A.I.T method has worked really well. I think I had my first clog. The first night, Bo slept for, I don't know, 5 or 6 hours longer than he had been. And I woke up and was like, oh no, I have a clog. He ate off that boob and it's still there, and it kind of got worse throughout the day. And so I started taking ibuprofen, 800 milligrams every 8 hours with Tylenol. Kurt was bringing me ibuprofen and Tylenol. I iced it with an ice pack and didn't overpump, didn't massage. I don't have access to therapeutic ultrasound, but just with the rest, the Advil, the Tylenol, the ice, it was resolved within 24 hours. And that has been the case with the next 2 or 3 clogs I've had since. I do always start on some lecithin when I notice a clog, and then I'll stay on that for a couple weeks, kind of spacing that out. And it actually has been awesome. And I think back to the clogs in the first go round, and I think we made it way worse, and they lasted a lot longer because we were just beating up on this inflamed, angry boob and just making everything worse. So breast rest, Advil, ice, Tylenol, and therapeutic ultrasound are the secrets to resolving a clog, hopefully within 24 hours. So that is a wrap on the new updated information about clogs. Please, if you have any questions, leave them below, as well as share any tips that you all have for resolving your clogs. We'll see you next week.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.